Hello, this is Dr. Vikki Petersen. Here's today's question. It comes from a gentleman who has celiac disease. He was diagnosed several years ago. He knows there's a genetic component. He's the father of 2 children, and he's wondering if it's prudent to get his children tested. They're not exhibiting any symptoms. Absolutely. You want to get your children tested as soon as possible, whether you have celiac disease or just or if you have gluten sensitivity. As maybe you've heard me say before, they're really of the same entity, with celiac disease just being the tip of the iceberg of the larger component, which is gluten sensitivity. What happens when a child is gluten sensitive? Our belief at this point is that celiac and gluten sensitivity are genetic, which means you're not acquiring it. Maybe there's a triggering mechanism that causes it to worsen as you get older, but the genetics are the genetics, and that doesn't change. So if you're born with it, there you have it. And despite no symptoms, why is it that we want to find out for sure? What happens is gluten is going to create a lot of irritation in the small intestine. It's going to cause malabsorption. Now, when our bodies are very young, they can put up with a lot. Maybe think back to high school or college and how you maybe didn't eat very well, you didn't sleep very much, but you still seem to be able to keep going, right? Young bodies are very resilient. However, the malabsorption associated with gluten sensitivity will catch up with you, and it's going to put you at risk for diseases later in life. Similarly, what happens with gluten sensitivity is a propensity toward autoimmune disease. Now, autoimmune disease might take 15, 20, 25 years to develop, but wouldn't it be nice to prevent that entirely and not wait until you have symptoms? Because autoimmune disease is a bit tricky. It means your own immune system is attacking you because it doesn't realize it's you. It thinks you are a toxin, some sort of invader. Once an autoimmune disease has really gotten a foothold, like MS, lupus, Hashimoto's thyroiditis, arthritis, celiac is considered an autoimmune disease, type 1 diabetes. All of these diseases, once they get a foothold, can be very difficult and sometimes impossible to turn around. So another very important reason for your children to know early in life whether gluten sensitivity is a part of their genetics. And also the nervous system, that's a very important component because irritation to the nervous system can also take years to manifest itself. We had several children with seizures who were gluten sensitive, several children that were having trouble concentrating in school. Some of them were just having trouble as students. Some of them were diagnosed with ADD and ADHD. Headaches, there's so many innocent symptoms that are associated with gluten sensitivity, and they are a stress and a burden on the body, and it's wonderful to diagnose early in life gluten sensitivity so you can really buttress yourself up against getting these diseases and these problems. So I think it's a wonderful thing to do. And don't feel guilty. Don't feel like, oh, I'm burdening my child with being gluten sensitive. Children are very intelligent and very quick, and we've dealt with a lot of children in our 20-plus years in practice, and children and adults, once they know they're gluten sensitive and they've experienced what it feels like health-wise to be off gluten and then inadvertently get exposed to gluten, whether on purpose or by accident, and feeling what they feel like once gluten is back in their system, what they say, one for one, is, I would never do it. It's so the burden of not having gluten in my system and how great I feel without it is so worth it that I'm not tempted. I really don't care. There's plenty of things to eat out there, so don't feel that way as a parent. I know often parents are concerned about that and birthday parties and things like that. There are ways around it, and definitely feel free to contact me. I'm a mother of 3, so I definitely have the ins and outs of birthday parties, sleepovers, etc. So I hope that's helpful. Last point I wanted to make is a really good test to utilize for children is a stool test. It's nice, it's not invasive, easy enough to do, so that's a great start, and the company that does that also, you can get a swab to find out, and it's just a mouth swab to find out what the genetics are to make sure that the child is expressing that gene for celiac or gluten sensitivity. So hope that helps, and until next time, I wish you very good health.